Hey, family, it's your family CPA, Jasmine Young, and you're listening to the Talk Wealthy to Me podcast. Get you a black CPA. We out here. Good morning, good evening, good afternoon, wherever you are watching from. This is your family CPA with another episode of Talk Wealthy to Me. And you guys, I know it has been a lot for us these past couple of years dealing with the Rona, but we got some special guests in the building today that's going to talk to us about health care. Miss Morgan Hale and Miss Kristen Ward, welcome to the show. How are you guys doing today?
Hey, we're good. I think one thing I would dare to say, we're excited, right? So, and it's funny because I know a lot of things that are happening in the world are kind of the opposite of that, but we're excited. So we're excited to share today's too. So thanks so much for having us.
Absolutely. I was amazed to see you guys launch the Culture Health healthcare program. And I'm so glad that you guys decided to come onto the show and discuss that because, of course, health is wealth, just like finances are wealth as well. So it's very important, especially in the Black and Brown community, that we discuss that and that we see people that look like us that can help us get healthy in our minds. So thank you guys for coming on the show and even just taking this this major feat to help our community be healthy as it relates to mental health. So let's get into it, you guys. Tell me about you guys. Who you are, what you do, and why you do what you do.
All right, I'll jump in. So Morgan Hale, as you know, one of the co-founders of the Culture Health, have a long, extensive history in healthcare. I will tell you, I started off as an insurance agent selling healthcare, and you can imagine being on the phone, hearing people crying about, $700, $800, even I had some with a $1,500 a month payment. So from hearing, the disparities of just the cost and how people were having to choose, living versus paying for their health care. I was like, okay, we got to figure something out. So over the years, I've been blessed to just be in rooms where I've been able to hear and learn and see where to go and how to actually start a healthcare company. And so, just stepped out on faith and was like, you know what, I'm tired of the Black community having to get second seat, right? So I'm like, I'm gonna do something now. I'm gonna step up to the challenge. Kristen, my other co-founder, is gonna step up to the challenge, and we're gonna go ahead and start making an imprint in the Black community because that's the purpose of it, is to be an influence in our community in the healthcare industry because we don't have that imprint right now. So I feel like I don't know if that was a question, but yeah, that's why I'm here. So
awesome. So yeah, go ahead.
I think also just one of the things that we both have in common, and even with our other co-founder, is like, this is such purposeful work. And I think that myself coming from corporate America, right? I worked for 2 Fortune 50 companies, and I was so used to the stability of what it was like to work, in corporate America. But I also had become a professional coach on the side. And a lot of the people within businesses that I was running, the clients that I had, they were people who had stepped out in faith, really, and were doing the things that they were called to do. But they felt like it was so risky. It used to be taboo. If you were an entrepreneur, you were like a risk taker. You were like, oh, you're walking away from your job and benefit, all that stuff. So it's so interesting because Morgan and I actually ended up working together. And this is one of those, like, all things work together for your good type situations, because I think in seasons of my life that I thought the experience I had would never be used, this was like a full circle moment. So, here we are, and it's a business that's really being a solution for people. And I think the timing is perfect. So, we're helping people, especially entrepreneurs and small businesses. I like to say we make entrepreneurship a lot less risky, because now you're doing what you're called to do, but you're not walking away from all the benefits, that you had in your stability of your regular job. So, yeah.
And I think that's so important because I actually found a statistic from the National Library of Medicine that basically said that self-employed people are associated with a greater risk of being uninsured. And they're also associated with a greater risk of delaying medical needs simply because they don't have any coverage because they walked away from their benefits. So I really commend you guys for taking on this mission to make sure that self-employed people like us and other business owners in the future have an option to make sure that they have coverage. So talk to me a little bit about the Culture Health. The big question is, are you guys an insurance company?
I'll take that one, Kristen. So no, so we are a healthcare company. It's so interesting because people always say it's insurance. We feel like it. When you have the program, you're talking to licensed physicians, right? We're in over 40 plus states, but
wow.
we are not classified as insurance because the primary tool that we utilize to get our services out there is virtual. It's 2022. I think if it's one thing that the pandemic taught us is that we really have to get comfortable with doing things online. And I know so they just actually passed it into law where you can actually do your primary care services online. Before you could not. You had to actually go into a physical location. So that's one of the—
I didn't know that.
Now, what was that?
I didn't know that.
Yeah, so you can now actually receive primary care. So we do offer primary care service. You can get your lab workups. You can get blood, tests. They send you out. It's really everything is online. But technically, we're not classified as insurance because we are a virtual healthcare company. Even though we provide primary care, chronic care, even urgent care, we can prescribe medication. So we can do all those things via the telephone, which is what us millennials like, right? We're so
right.
Our home. So we're just making it easier. And that's one of the reasons too that we wanted to branch out. And of course, we wanted to be the face that really promotes this in our community, is because from a cost effectiveness, when you take out the facility of a healthcare institute, right? When you take out that facility piece, it brings that cost down significantly, and we're able to reach the masses because now you're not subject to having to go into, I'm in Atlanta and you don't have to go on Peachtree Road. You can actually literally pick up your phone from anywhere in the nation and get access to a doctor. So we're solving solutions from a cost perspective, but also from an access perspective, being able to get quality, treatment. So
and so this is like a fun way I like to put it. So like for everyone who's listening and you're like, okay, like what does that really mean, right? We're not insurance, but we're healthcare. So this is like the way we kind of frame it, right? So think about it like a bank and a credit union, right? A credit union isn't necessarily a bank from like a regulation standpoint, but you're going to get the same services, right? So when you go in, you're going to be able to do the same stuff with your money. You have a lot of the stuff looks the same. It's structured very similar for the client.
They have better rates.
It's everything on the back end, right? They get better rates, but it's, so it's kind of like how it works on the back end that makes the difference, but how you receive it on the front end is very similar. And to your point, Jasmine, it's cheaper, right? So we get a little more control with the costs and things like that for sure.
Yeah, people love cheap. So look, if y'all are listening and you don't have any health insurance coverage, or you aren't under any health insurance program, the Culture Health is definitely for you. So talk to us a little bit. I went to you guys' website. Love the website, by the way. Look, it just looks like it's for Black and brown people. I love it. Talk to us a little bit about closing the gap in wellness equity. What does that mean and what does that look like?
Yeah, one of the things a lot of times when we are kind of sharing to different clients and people who partner with us, you should see, and I think you mentioned some of it, Jasmine, the statistics you would see about how people feel when they go to healthcare facilities, the treatment that they get, the unfairness that's out there. I mean, it's a real issue to the point where there are some people who've had bad experiences that have literally stopped them from even engaging with like healthcare. There's a lot of stigmas around healthcare. There's a lot of like misunderstandings, even just like some of the things we've already talked about. So I think one thing that we really have prided ourselves on doing is making healthcare simple and making it accessible for people, who look like us, for people who work in industries like we work in. So there is no off limits. You know what I'm saying? We really are. And that's one thing that we talk about a lot is bridging that gap. So no one's intimidated about healthcare. It's not something, a lot of people right now, even if you're listening, you're on a job, you may not even understand what you have, your benefits. You went to an HR person and you just got, whatever works for you. So really just empowering people to understand and take control again so that we're knowledgeable about healthcare And we also feel like it's a space that we belong in. So I think that's kind of our take. And I think wellness equity is like a big deal in our world for sure.
Wow, that's amazing.
I wanted to say this too, you know, one of the reasons that we started this is because when you look at the statistics, Jasmine, what really broke my heart is life expectancy. I don't know if you saw that, but it's real. So, you know, the life expectancy of the Black individual is about 5-6% less than any other ethnic group in the world. In the United States. Not only is the life expectancy, but we also cap out in every single medical category: high blood pressure, high cholesterol, diabetes, every single category. We are at the top for individuals who have these diseases.
Right.
Look at it, when we did the research, if you look at it from the 18, like 0 to 18, it's pretty much even, right? So whether it be our white counterparts, whether it be, you know, our Asian counterparts, it's pretty much even. But as it grows, by the time at 50 plus, it's a huge gap. And a lot of it is because we're not taking care of ourselves.
Right.
Kristen's point, we don't even feel comfortable to walk into a facility just because we've had a bad experience or we heard someone that had a bad experience. That was another reason why we wanted to focus on promoting the virtual, because there's a certain level of comfort that you receive when you're in your own home, when you're sitting on your couch, when your loved ones are beside you and you're speaking to your doctor right there over the phone. You don't have to get up. You don't have to go fight through traffic. A lot of us, let's just keep it real. There's some people that are struggling to the point where they have a hard time even making it to the doctor's office.
Right.
They have to travel so far, or they have a limited network. Another disparity that a lot of people don't know about is of the Black Americans that have health care, it's like over 70% are on government funded health care. All for, you know, I don't want to, you know, for politics, but I do support government funding. But one of the things that the government is trying to tackle now is it's still very limited options, right? So even though I have healthcare, I only have 2 doctors in my area to choose from.
Right.
We have, you know, this doctor has bad rate. I know a friend of mine, I remember she was so upset because she was on a government program and there was only 2 doctors in her area, and they refused to treat. They said, oh no, you're fine. Your symptoms are not ones that warrant anything else. And she had to wait an entire year before she could even seek the opinion of another doctor. And so that was another thing that we wanted to make sure is, let's open up the options. Let's make sure that no one is subject to 1 or 2 doctors. Like, that limitation just has to stop, right? So that was one of the other biggest things, is not only from a wellness perspective, we want to get people comfortable with just going to see their doctor, because we have to close that gap at the beginning. We got to, with us, right? The 20s, the 30s, the 40s, we've got to start closing that gap and going to our primary care and getting our annual checkups, because that's how we're going to increase our life expectancy.
Yeah.
We're going to decrease on all of these different diseases that's really just taking a hold of us right now. And then something else, and I'll go ahead and talk about it. One of the other heartbreakers, because it's in the news right now, and I wanted to bring it up, is all of our programs have access to mental health counseling 24/7. And then our premium program gives you access to a psychology or a psychiatrist. And I say this because that's another issue in the Black community, right? Let's just, you know, talk about the elephant in the room.
Right.
We have been taught from birth, you know, what happens in this house stays in this house.
Right.
Be strong. You know, someone else has it worse than you. So you hold your head up and you walk out high. You walk out there, you know, with your head held high and don't say anything. We've been taught from early age to swallow whatever it is that's going on inside of us and to put on that happy face and, you know, break through that glass ceiling. But because of that, right, we have people that are breaking through the glass ceiling and they're still suffering. Like, after they break through, they're still trying to figure out, okay, you know, how do I find fulfillment in my life once I've accomplished this goal? And so one of the things that I saw, I believe was the 29 and under, the first leading cause of death was accident, you know, like car accidents, something like that. But the second leading cause,
suicide.
Suicide.
Exactly.
We're going to talk more about that, because this is a really, really touchy subject for me, because earlier this season, our first episode was Health is Wealth, and I shared my story about my mental health journey. So hold that thought, you guys. We'll be right back. We're going to cut to a quick commercial. Come back. Make sure you are in on this conversation, because we're talking all things the culture health. We'll be right back.
So if you haven't subscribed to my podcast, make sure you download my CPA Firms app. And once you download it, click our podcast. Once you click our podcast and the page loads, you'll be able to see all of the episodes we've ever recorded for the Talk Wealthy to Me podcast. And if you really like the show, you can support us through a monetary donation by scrolling to the top and clicking support. Don't forget to subscribe to the show.
Welcome back, welcome back, welcome back. We are here with Miss Kristen Ward and Miss Morgan Hale, the co-founders of the Culture Health. And we were just getting into a very, very important and sometimes uncomfortable but necessary conversation: mental health. So you guys were basically saying that your healthcare programs, all of them at every tier, offers mental health care. Talk to us about that, because there is a statistic that suicide is one of the second leading cause of death in individuals ages 29 and younger. So talk to us about how you guys incorporated that and how people can actually take advantage of that specific feature of your programs.
Yeah, I'll speak to it a little bit first, and then Morgan, how about you get into kind of how these work on the plans, right? So one thing I wanted to make sure that we mention, just even in this talk, with you, Jasmine, and I know some of your audience and things, they could really appreciate this. I think some of that taboo that's been around mental health, especially in Black and Brown families, I think our approach is really for more of like a preventive care. I think that a lot of times people wait until they're in such a bad situation, right. You know what I'm saying, to where you don't even have the energy to pick up the phone or connect with some sort of mental health source. But right. Just knowing, I think some of the peace of mind of just knowing that you have access to that makes a big difference. Right. And this goes back to some of what I would even encourage, for anybody out there, right? Because life has been a whirlwind for anybody. We have to let go of that stigma when it comes to mental health, because you deserve to be mentally healthy. You deserve to be able to release and let things out, and also just have a safe space. And I think we have to create that safe space within our community first to say, hey, it's okay. It's wise, to seek help, strong people seek help, and not condemning or even shaming people about doing what's best for them. So I think that's one thing even more, because we've seen, honestly, while we're in this conversation right now, over the last 10 days, we've seen a spike even more, on a public level when it comes to mental health. So just imagine the day-to-day people where it's not blasted all over the world, the people who are tucked in their homes and, in every state and city and county and things like that. So it's something that we're very passionate about. And I think the timing with where the world is just this is major, major, major. So we can even talk about kind of how it works. So people can know, because it is on every plan, right? So it's kind of like a secret weapon, right. Even the cheapest, the most affordable plan, you still have access to mental health.
Absolutely. Tell us about that, Morgan.
Yeah, so I'll jump into really tackling mental health on two ends. And it really hits personally for me, because my family does have members who struggle with mental health, to be honest. So we look at it from two aspects, right? So first off, you've got the individual who, for the most part, doesn't have, any major concerns, but maybe they're just having a rough day. Maybe they took a hit. Maybe someone got COVID. I just saw a statistic out the other day that said that they're linking COVID to anxiety and depression, which I believe it. I mean, I've seen it firsthand. So from one's perspective, we do have 24/7 around the clock access to mental health counselors. So every single plan has that. So let's say you're experiencing some, anxiety, some severe depression. Maybe it's 3 a.m. and you don't even know who to call because you don't want to be a burden on your friends. You can literally just pick up the phone, hit that phone number and call, right? And then you're going to get someone. That's one of the things that we want to make sure that everyone is aware of, that we have 24/7 access to a mental health counselor. But let's take it a step further. And, I remember there was a loved one that we had that we were trying to get help. There were some things going on with this individual. And I remember, not to get too deep into laws and things like that, but, you can't get someone treatment if they don't want it or if they don't try to hurt someone. So I don't know if y'all are familiar with that, but I see you shaking your head, Jasmine. Yep. But if they're, you can try and beg them, but unless they try to hurt you or themselves, you're not gonna get treated. So it was interesting. We had one of my loved ones, we were trying to get them help, and to see a psychiatrist, it was over $300. And when you're trying to get someone diagnosed with a mental illness, and you have to have a specific amount of, because when you're doing mental illness, that's dealing with the state and things, but you have to have so many documented conversations with the psychiatrist. And it's over $300 something. It's a really big burden on the family. So one of the things we also wanted to make sure is that people had access to an affordable psychologist or psychiatrist. I was literally talking to an individual the other day who has to see a psychiatrist, and that was literally her testimony. She was like, I'm paying out of pocket $300 every time I go, and I can't even get access to my meds. So one of our programs, we do have a copay. It's a $100 copay for a psychiatrist. And some people say, oh, $100 is a lot. It's
compared to what it is in the healthcare industry, that's good.
Right, it is. And again, they can prescribe, they have access to what's called the EMR, which is a national medical system. If you go to a hospital, if you go to an urgent care, it's the same system. So if you did receive treatment, they have access. All of our doctors have access. We are on the EMR system too. So that's one of the other things that we wanted to make sure that when individuals are trying to get those family members help, when they're trying to, go the right route and get them treatment and get there. Let me just say this too, because it's a little near and dear to me. I know I'm talking a lot, but we have got to, in our community, I tell my family member, I'm like, mental health, that's just like if you were diabetic or if you had high blood pressure, like, let's get you regulated and get on those meds. And the only person that can do that
is you.
Go. So we're providing that. So just to bring it back home, we do provide, or we're tackling mental health on two ends. If you're that entrepreneur and you had a rough day and the burdens of the world are on you, speak to that mental health counselor. Let's get someone, talk through some breathing techniques, talk through some how to just release, right? It's a safe place, like Kristen said, it's a safe place. And you don't have to worry about, are you being a burden to your friends, or is someone going to see you down and cry? No, you don't have to worry about that. Call into the mental health counselor. But also, if you are that individual that's having more severe issues where like we talked about the suicide early, like if you need to get on some medication, let's get your hormones and your blood, like let's get everything balanced, right? Like, we also give you access to that psychology and that psychiatrist where if we need to take it a step further, they can. And so the two aspects that we wanted to make sure that we covered, in which we are.
Gotcha. That is awesome, you guys. So I really can appreciate you guys really honing in on the importance of mental health as well as physical health as well, because people don't realize how much of a burden having mental health issues are when you don't have anybody to talk to, when you don't have somebody, that understands and that can assist you, because it's not just all in your head. So I appreciate you guys for incorporating that into your programs, because it's definitely needed, especially with everything that's going on in the world right now. And, suicides popping up left and right, Regina King's son, and, all of the Miss USA. That was just unexpected. Yes, it is. So I think it's very important, especially during this pandemic. Everybody's feeling something. I did want to touch on, you mentioned something about those that have a hard time even getting to the doctors. Does your program cover all individuals? Who qualifies? What age ranges? Talk to us about that.
Yeah, I'll jump in real quick. So yeah, so right now, we do 3 and up. The reason why we say 3 and up is, as you know, when you have a little bitty baby, it's from a virtual perspective, but we do 3 and up. So one of the things that we is twofold, because again, we're talking about the Black community, so we're just gonna keep it real, right?
Yeah.
One of the other things we wanted to make sure, so not only can you be 3 and up, but even on our family program, I know in my family, I've got, where, a niece may be staying with someone or a cousin may be staying with someone. So one of the things we also wanted to make sure was that from a dependent care, you don't have to show proof of dependency for the kids, right? Like, if you with your job, they'll make you turn in all kinds of records and birth certificates.
Right.
But the reality is that's not the case in our community. That's not the case in a lot of people's family. You may have someone that's struggling and, you have to keep a niece or a nephew for 6 months or so. And it's very hard to get those individuals insurance just because of the regulations, and you have to, show different paperwork. So who is it for? From ages 3 and up. We can do a family, we can do individuals. From a family perspective, we ask that everyone is in the same household. That's how we classify our family. So if you live in the same household, you're a family, and we do families of 5. Now, you know how we don't want the Netflix, right? Where everybody got a Netflix account.
Right.
So if you go above 5, then there may be a little extra in there, but we're going to give you, 5, so you can be an adult and 4 independents, or 2 adults and, 3 dependents. But that's who it's for. And again, we're national, right? I think I had a couple of people say, well, I'm in Tennessee or I'm in California. And we're like, that's fine. You can still get a program. And if you're in Georgia and you travel to California, you can still use the program, right? You can use it wherever you are. It's a whole triage system. So they're going to make sure that they get you a doctor in the right state. But yeah, we're for everybody. We are for everyone. Even if you have family, I don't know, Jasmine, you have people coming over here from, you got a little Bahamian or something. So you got someone coming over here from the Bahamas, they can get on the program while they're here. Get them a little health care if they visiting for 30 days. They can get on too.
That's awesome. I like the fact that, even people that are coming in, your family that are just passing through, they can have healthcare coverage. That's a big thing in our community. Things come up and people have to come and live with you for a while. And you're like, okay, what do I do with the healthcare situation? Where do I go? What if they're not insured? So shout out to y'all. This sounds like a very, very dope program. I know I have some people in mind that I'm going to plug you guys too, because it's needed. And it's very, it's like you said earlier, it's very mission driven work. It's definitely something that our community needs and can benefit from to help us live longer and live better, have better lives. So before I let you guys go, I want to ask you one question. If you had to explain this program to anyone, if you wanted them to take anything away from what you've said today, what would it be?
I think for me, it's healthcare is simpler than you think. You deserve healthcare to be healthy, and you don't have to pay as much as you thought you had to pay for it.
That's awesome. That sums it up right there. It's simple. It's more simple than you think. I can't let you go without plugging your website, your social media handles. How can people get in touch with you? How can they get on a program? How can they just connect with you guys and just follow the Culture Health journey on this very important mission that you guys are on?
Yeah, so I think it's kind of consistent, the name across the board. So theculturehealth.com. So you can go to the website. And this is one thing that's really cool too. So if you like have your phone in your hand or you're at the computer or whatever, go to theculturehealth.com and you can self-enroll, right? So we have laid it out and made it super simple. And I've got to say this, you all, because literally for $49.99, that is where our plan starts. So we're talking about mental health, even in a package that's that inexpensive. And I know anybody, myself included, we've spent more on worse, right? So I think this is something that definitely deserves just even that little bit of contribution from you, each month. But theculturehealth.com, even on Instagram, we're theculturehealth.com. Well, The Culture Health, you can find us there. So make sure you stay plugged in and connected. There is so much that is happening, and there's going to be so much that we see come from this and evolve. So if you're out there and you don't have healthcare, you'll sleep better if you go to our website, right? Go to our website. Yeah, and make sure that you that you do this, because health is wealth, right? It would do good to make a bunch of money and not be able to enjoy it. You know what I'm saying? So theculturehealth.com, we're kind of a little bit of everywhere. Also, personally, our Instagram handles, mine is just I am Kristen Ward. So you can find me pretty much anywhere at I am Kristen Ward. And I'll let you mention yours as well, Morgan.
Yep, I am Morgan Hale.
Wow, identical handles. That's crazy. Wow, that's awesome. So, okay, guys, you know how we do it. I need you to go to theculturehealth.com and crash the website. I want an overwhelming amount of enrollment. I want to see an overwhelming amount of people getting these mental health services, because we definitely need it. Thank you so much, Kristen Ward. Thank you so much, Morgan, for coming through and just sharing your passion and your mission for our people and just for the healthcare industry all around. It's definitely appreciated from one Black woman to another. You guys are awesome. I love it. And keep being great. Keep doing what you're doing and keep impacting the world.
Thank you for having us.
Absolutely.
Thank you, Jasmine.
Absolutely. This has been another episode of Talk Wealthy to Me. I am your host, your family CPA, and I'm wishing you love, peace, and generational wealth.
Somebody say, hey, we want some. Thank you for listening to this episode of Talk Wealthy to Me. Remember to subscribe to our YouTube channel, like, comment, and share.